Hi there, we're here at Cluster 5 AT8 Written Assignment Wound Care. As you can see, this assessment task requires or consists of 17 short answer questions. There's a list of resources regarding the information that will be required in this written assignment, along with your Foundations textbook, Chapter 27, and the online video, which is a part of session 208. The online content will also help you gather the information required for both the written questions and also the wound care table, which we'll go through shortly. So the resources, the websites are all listed there and hyperlinked. These 17 short answer questions are a part of a quiz. We've also attached an assessment reference document with all those resources, website pages attached to that, along with the 17 questions in that quiz. I urge you to download that, make notes on it as you're doing your research, and have all the information all in one spot. It's a good tool to use to go through that. As you can see there, there's also the wound care table here. That's also a part of this assessment task, which will need to be populated and uploaded on EduOnGo once completed. So I just want to get the quiz task. I'm just going to bring this over to the screen here. So this is part of the 17 questions regarding on this assignment. So basically, the first question being, briefly describe the process of normal wound healing. So this is talking about the processes, what happens in each stage, and in pretty much 1 to 2 sentences to describe or talk about what's happening in each stage. Question 2, outline the 3 benefits of moist wound healing. So once again, 3 short sentences stating what the benefits are of moist wound healing. Question 3 is list 3 aims of wound management, so what we want to achieve, A, B and C, when we are aiming to manage and heal wounds. Question 4, I'll leave that just for now. I'll actually come back to that table to talk you through that table. Question 5, explain why a holistic approach to wound assessment and management is important for when caring for patients, what things we need to consider, and so forth. Question 6, describe how you would choose a wound product for a heavily exudating wound, providing a reason or a rationale for your answer. So we're talking about dressings, meeting the needs and the style of the product, what things we consider to achieve the healing there. Question 7 is describe a visceral wound and provide 1 possible cause of this type of wound. So this question talks about what makes up the viscera, where would this wound, in what part of the body would this wound be, and give an example of how this wound was caused. Question 8, list 3 possible complications of visceral wounds and describe 3 nursing interventions to avoid serious harm to these patients. For this question, we are talking about things that can go wrong with visceral wounds, what other structures can be sort of damaged in the process, and what nursing interventions would be, and what we would do about them to actually prevent those complications. Question 9 is list 5 clinical signs or observations, things that we can observe from a wound that would give us information to let us know it's possibly infected. So what things we would look for and document. Question 10, identify one diagnostic test that could confirm a wound infection. So what's one thing we could do to confirm that a wound is infected? Question 11, define a neuropathic ulcer. So here we're looking for information talking about what it is and why it is formed. Moving on to question 12. So outline the steps required to collect a wound swab. So things we would need to do and processes we would need to undertake to take the swab from the wound. Question 13, so reading the essential clinical skills, enrolled Div 2 nurses, part 4.1 on aseptic technique, and answer the following questions. So part A, describe the 4 key principles or ideas of the aseptic non-touch technique, known as ANTT. So what you need to do, what are the ideas and concepts about the aseptic non-touch technique. Part B is define the following. So in 1, the key part, what it does in this process. What does the key part? What is the key part? Identify what is the key site in this process, and then question 3 and question 4 are talking about standard non-touch technique. Talk about or describe the 5 ideas of this technique, of this approach when doing a dressing or a procedure. Question part 4 of this is the surgical non-touch technique, so much more invasive, much more involved, and talk about and describe the 5 principles of that technique. Because there will be differences between a standard non-touch and obviously a surgical non-touch, and we want to know what those differences are with your answers. Question 14, describe the 12 principles used in the practice of aseptic technique. So what does it mean when used in performing a sterile technique? You can certainly think back to when we had catheterization and went through that in the lab. There was the aseptic technique, all the steps involved with doing that process of setting up that dressing tray aseptically to then go on to perform that procedure. Question 15, name 3 ways wound healing progress can be assessed by an enrolled nurse. So 3 assessment measures, what we're actually looking at, documenting in regards to the patient's wound, as to get information that's going to indicate to us that the wound is actually healing. Just move down again, just last 2 questions. Question 16, explain why a Doppler ultrasound might be used in wound management, and how and what impact would it have on the wound? What sort of information would you get, and how would that help with our assessment of the wound? And question 17, identify 2 benefits of compression therapy to people with wounds. So why would we put compression therapy on large tubey grip bandages on over a wound once we put a dressing on the wound? Why would that be good for the patient and the wound? So they're the 17 quiz questions. I'm just going to pull across that wound care table, which is a part of question 4. Just bringing that across now in here to look at. So here we've got, I'll just move this again. Is it in? Oops, I've lost it because I just popped it here. Okay. I hope you can see this pretty much is our wound care table. So we've got the type of wound, defining the definition of the wound, the amount of exudate that we would expect with each of these types of wound, and there is 10 wounds in this table to fill out. Would there be odour, yes or no? A pain management plan surrounding these types of wound. The wound management plan, so what we're actually doing for the wound and why we're doing that, implementing that rationale to heal this wound. And identify what would be the potential problems and complications related to the type of wound and the individual. So for example, with this, the first one being a surgical wound on a 5-year-old boy is going to be relatively clean, small. There's not going to be hardly any exudate. I wouldn't expect that there'd be any odour to that wound. This little boy is 5 years old, so in terms of a pain management plan, we would be looking at here with this in terms of assessing his whether he has a mild or a moderate amount of pain, and managing that with regular pain analgesia as ordered, and assessing his overall comfort with that wound. So in terms of the wound management plan and rationale, we would be sort of leaving this dressing intact and removing as per the doctor's instructions. Being 5 years old, coming in and having a daily dressing change is possibly not in the patient's best interest. So we would be just watching that dressing and monitoring for signs of other signs of infection without actually going in and physically changing it every day. So just in terms of potential problems and complications related to this type of wound, so being 5, we will assume that he's a lot more active and restless than an adult with this wound. So he actually may have trouble telling us he's got some pain, and will have less emotional control about his pain than say an adult would. So that's the type of information that we're looking for when you're completing this wound chart. So we'll continue on populating the other 9 until you complete that wound chart and then upload it to EduOnGo.